Let's talk about this dangerous pandemic, COVID-19. And this afternoon, there's a race against time to prevent further deaths as the Ghana Health Service rolls out revised measures to control the worrying surge in COVID-19 cases, which they say is largely driven by the Delta variant. Ghana Health Service data shows as many as 21. There's as many as 21 persons are dying in the first 17 days of July, but the lack of adherence to the protocols, limited access to COVID-19 testing and contact tracing, among others, remain a challenge.
2021 recorded a total of 99,734 COVID-19 positive cases, with 817 deaths. The country's active case count of 3,466 leave health authorities worried. Director General of Ghana Health Service has been explaining why the country is experiencing an upsurge in cases since December.
The emergence of new variants with high infectivity further complicates the currently observed and currently observed non-adherence to COVID-19 safety protocols. Other threats include the outbreak of cases in the neighboring countries, surges in Ashanti and Greater Accra, which is the main hotspot in Ghana, low vaccination coverage so far, and the entry of the Delta variant into the Ghana, and lastly, but not the least, outbreaks in some of our schools. The threat of a third wave in Ghana is very real.
Dr. Kumampuaji says a new proposal on funerals is being developed to curb the spread of coronavirus through social events. He spoke to the media at the end of a two-day high-level strategic meeting on COVID-19 in Kumasi.
As part of the protocols that have been designed, includes how funerals, etc., should be organized. And just like the protocol, I think it's not being adhered to, not just by one group of people, but clearly many people are doing that. We are in discussions coming up with a proposal that limits the spread, that makes it safer, and whilst people still go ahead and have a funeral, we think that is such a deep cultural thing that it is not something you can just wish away. And so we have a draft protocol that we are sharing to ensure that, how do we ensure that we still have our funerals in safety?
According to Dr. Kumampuaji, Ghana's health system has some inherent strength, with the training of critical staff and increase of treatment centers from 2 to 70 since 2020. He, however, says a third wave of COVID-19 is imminent if the attitude of the citizenry remains unchanged.
The rise in cases is of concern to the Ghana Health Service, and this necessitated the strategic meeting of senior managers and our partners to address the increase in these cases. Our current system has some inherent strengths. Capacity for case management has been strengthened with an increase in the number of treatment centers from 2 to about 70 currently, with a treatment center in each region. Training of critical care staff and the provision of equipment has also been implemented. The establishment of the Ghana Infectious Disease Center is one. The establishment of electronic data collection system for surveillance data collection. A robust laboratory capacity from 2 in the early 2020 to 400 total currently. We also have a capacity for genomic sequencing as a country. However, all these capacity can be overwhelmed if we do not avert a third wave, especially driven by a Delta variant, which is highly transmissible.
Meanwhile, Ghana Health Service has been outlining some measures to tackle COVID-19 upsurge in the country.
We want to mobilize all our opinion leaders, our religious leaders, traditional leaders, key influencers, etc., in putting in place contextual risk communication messages for locations such as schools and workplaces. We will continue to scale up our testing capacity for COVID-19. We will scale up the use of antigen testing. Antigen testing will be used as part of our rapid response in locations where there are outbreaks such as schools, workplaces, and points of entry. That's our borders, our ports, etc. We will strengthen our contact tracing and quarantine isolation. On the areas of vaccine, importance of vaccine in limiting the transmission cannot be overemphasized. Ghana is increasing its capacity to handle different brands of vaccine, including those that require ultra-cold storage facilities. Ghana is trying to source more vaccines to cover as many people as possible, and we'll be prioritizing hotspot areas, districts, highly populated areas, and at-risk groups, that is persons over 60 and above. Despite all these efforts, vaccine hesitancy needs to be tackled so as to ensure the maximum vaccine uptake when the vaccines are available.
From Kumasi, for Joy News, Oyinrinteria reporting.
Well, we've been speaking to members of the public on why they're letting their guard down. Here are their reasons.
I don't think it's rare because recently when I watched European Champions Cup, the final match, the whole Britain, the Wembley, the biggest stadium in the world, even one single person are not wearing masks. They are just hugging themselves, kissing themselves. Look at the number of people in the sports stadium at the final match between England and Italy. You see the number of people in the sports stadium, Wembley. No single person wearing face masks. So I don't think it's rare.
The sensitization has gone down. That is one. And then the figures being churned out by the government has also come down. That is why the awareness is down. Hence, some of us not wearing it. Well, I would like to wear it. I was wearing one. I'm just from the court. I came to Circle to repair my phone, and I had to take it off.
I've been hearing about the new variant that is in town, Delta something, and then we need to observe the protocol. And I have some friends outside who even had the injection, but I'm told some of them have died. So that kind of makes me want to be precautious and don't want to take things for granted.
Before we was thinking that no, the disease is not there. But now the cases are still going higher. The disease is, so now as for media, I'm protecting myself. I have to protect myself because I don't have money now. If anything happens, I don't have money where I can go to hospital. So I'm just wearing this to protect myself.
Well, let's get some updates from the Ghana Health Service portal where we can get information on what is happening about our COVID situation today. It's coming on your screens right now. And new cases stand at 304. Active cases now 3,466. Confirmed cases now stand at 99,734. You have recoveries at 95,451. Deaths at 817. And if you look at the gender distribution, you have 42% of the infections being female and 57% of them being male. Now, there's also a regional breakdown in that map there, and you see Greater Accra and the Ashanti region leading. Greater Accra is leading and is followed by the Ashanti region, and you can see that there are other regions that are following there. Western region is following the Ashanti region with 5,991, Eastern region with 4,572, Central with 3,565, Volta with 2,704. Meanwhile, the Director of Procurement at the Ministry of Health has put up a spirited defense testifying sole sourcing before ratification as grounded in law, even though this did not go well or without a rebuttal. Speaking before the Parliamentary Committee probing the procurement contract of the Sputnik V vaccines, which has since been terminated, Director of Procurement said the propriety of the action is proper under certain constraints.
Exhibit 6, paragraph 1, 2, 3. The board decided that an investigation should be conducted in accordance with Section 89 of Act 663 as amended to ascertain the circumstances that gave cause for Ministry of Health to undertake the said assignment with says a team of investigators will therefore visit your organization to undertake this. So in the PPA response to your letter, they admitted that there was a violation. Do you agree to that?
I don't, Honorable Chair.
For which there will be investigators to investigate.
Can I, Chair? Chair, can I?
So, Mr. Chairman.
You see, honorable colleague, I decided to lay back because at a point, maybe a certain impression was being created that you were being. We also have before us a letter from the minister to PPA for ratification. As a matter of procedure, PPA would have to investigate the grounds for you proceeding prior to the authorization. Yeah, you didn't come to them. The law allows for you to come for ratification. Wait. He has quoted, well, the matters of law matters of law would be in our reports. He has argued emergency laws and the situation we found ourselves. So I am saying that put that question to you. If you punch holes and deal with that, and you are allowed. But when you are doing back and forth, he said, do you agree? He says, I disagree. Then maybe so get him to give you the facts.
So, Mr. Minister, you know the public procurement does not have the authority to ratify single source procurement. There could be ratification of other whatever, but single source procurement, there's no provision in the Act.
Where is the Director of Procurement? Are you here? You took an oath. Are you able to take us through? Is there any provision in the PPA Act as amended which allows for ratification?
Thank you, Honorable Chair. Honorable Chair, I think it's only under single source that even you have to apply for ratification. Because if you open tender and you have other submissions and you award your contract, that is the procedure. But because under the circumstances, you could not apply to PPA to give you the approval to do single source, and you went on to do single source, then now you have to apply to them that based on ABCD, I went ahead to engage this firm to undertake this assignment for me. So I am applying for you to ratify that process for me. Their investigation, gives you the justification that you should use single source or you should do that, then they grant you the approval. If their investigations comes out that it is not right, then they take decision otherwise. So, Mr. Honorable Chair, it is right to use single source procedure and ratify. Okay. Thank you.
Now, your lawyer is, the Director of Legal is by you, but since you are the Chief Advisor on Procurement, with all these explanations, it is your case that they are in the law. Answer. Is your case that is in the law?
Yes, Honorable.
The explanations you've given.
Yes,
it is your case that they are in the law.
Yes, Honorable Chair.
Let's now speak with Nana Akanaku. He's a research fellow in the Department of Health Policy and Management at the New York University School of Global Public Health, where he's also a doctoral candidate. He's a health economist and policy analyst specializing in healthcare systems and health services. Doc, I'm grateful for your time this afternoon. First of all, what do you make of the current situation with the surge and the attendant deaths?
Good afternoon. Thanks for having me. Just quick clarification. It's not done yet. I'm defending later this year. I think what we're seeing in terms of the numbers right now kind of reflect what that have imported the Delta variant, where you have a sudden and very sharp spike in cases, which is often followed up by, pretty much immediately, well, not immediately, about 2 or 3 weeks later, an increase in deaths, and generally widespread community transmission of that variant. I think from that, it's important that we have clarity on what that means for our healthcare system. And I think that when we think about the protocols that we are rolling out, the measure of the effectiveness or the suitability to the moment should really be the question of the healthcare system. Are we doing enough to make sure that we don't have so many infections, that we have a high number of people needing severe critical care who then cannot get it because the health system might be overwhelmed? And when you have the Ghana Medical Association and other healthcare providers already telling us that we have an issue when it comes to actual availability, well, not actual capacity for care, or we are nearing the capacity for care, which, to be clear, is not just about beds. It's about having enough staff, about having enough oxygen, about having enough of the life supports and the life-sustaining medications. They're telling us that they are almost at capacity. So when it comes to what we have to do now, the question is, how quickly can we tighten those things up so that we are actually meeting the necessity of the moment, which is breaking the chains of transmission very aggressively and very quickly.
There are a number of things officials would have to do to ensure we are safe and controlling the spread. But one of this is the enforcement of the rules and the many others that would help us help deal with the situation. Are these being done?
Well, I think there are obviously some high-level protocols in place that have generally been disregarded. And I call those the higher-level ones because those have to do with the highest risk situations. So, for example, you can take settings like clubs, which are indoor venues where people are drinking, and because they're drinking, they don't wear masks, and because they're indoor, they're not ventilated. Those are very high-risk settings. And we know for a fact that since even the time that Ghana Health Service announced that the Delta variant was spreading the community, there has been no real enforcement of those closures at all. I live close to Suan Laboni. The weekends have been loud and active. So we know that those settings, which the Ghana Health Service itself said were main drivers of the December to February surge, are still open. Those are still happening. It's important to bear in mind also that even the question of the Delta variant, we're talking about a situation where, speaking to why it's important to move quickly about this, situation where, despite the fact that we got the announcement on July 1st that we had community spread, the actual samples involved were taken as far back as May. So we know that we've had several weeks where our guard has been down, where enforcement of protocols on funerals, social gatherings, all of that hasn't been done. I'm not sure we are seeing that yet. I don't think if you go outside right now, what you are seeing in the public in terms of mask wearing on trottoirs or even just Veronica buckets in front of stores, I don't think that suggests that the ship is changing direction just yet. So I really do think we have to double down on these enforcement efforts. And some of that has to do with better risk communication. You cannot get people to take something seriously if you are downplaying its seriousness. That's obvious common sense. So it's important that we communicate candidly about the situation at hand, make people understand that this is not a good time to be taking risks, because if you don't luck out and you get infected and you have a bad case, if that's happening 2 weeks from now, 4 weeks from now, if the trend continues, it may be difficult to find a bed for the life-sustaining or life-saving care you need. So it's important that that is communicated clearly, that the Delta variant spreading in the communities widely is made clear and not presented as something that's happening in isolated pockets. And it's important also that in risk communication, that action follows words, so that the people who are enforcing the laws or asking us to abide by them, asking us to make sacrifices, are living up to the example, are living up to the moment. Because without that, you end up having a scenario where there are a lot of people who say, well, it can't be that serious if. It can't be as bad as this situation because they're saying this. And that comes down again, not just even this, what we do, but how we talk about COVID. And that involves, not saying things like funerals are not places where COVID spreads and schools are the safest places, because those are things that we don't know. Those are things that the data also does not support. So it's important for us to have, a more candid conversation to get people to understand that the risk is real and that compliance is really important at the individual level and at the national level.
Doc, we heard in that interview with the public, many simply don't care. What can we do to ensure they take the issue seriously?
Yeah, I think it comes back down to my previous answer, that we have to be able to communicate to people. There's a question of community engagement. So it's not just saying you've done some adverts, so you finish your communication about COVID-19. You have to engage community leaders. You have to engage people where they are at the level that they are. You have to have diverse, multilingual communications that are more dynamic. And you have to do a lot of that in the digital space, where a lot of people are getting their misinformation from or their doubts from. Those things have to be done quickly, but it also requires, like I said, candor about the reality of the situation. If people do not perceive that the Delta variant presents a new risk, or that it's not widely spreading, or that there's no need for any necessary public awareness or public anxiety about it, then they will not respond in the way that we are looking for. So it's important, again, just going back to the simple things in public health risk communication. Speak the truth, speak it early, and speak it often. And that's what we really need to get back to doing to make sure everybody's on board.